So the diaphragm is actually really important. It basically functions as a piston within the thoracic cage, and it actually helps a lot of different things. And the lymphatics, actually, the diaphragm's kind of a big deal. But also there's your pelvic diaphragm, and then there's a respiratory diaphragm. And some people like to specify that. So this is when I just started calling it respiratory diaphragm so that there was no confusion that I wasn't talking about the vagina. It has everything to do with changing the pressure within your body, specifically what we call your intra-abdominal pressure. If you wonder why I say the respiratory diaphragm and not just diaphragm, this is why. I was actually doing my doctoral work and studying the respiratory diaphragm, and how all other cultures treated it. And the reason I just say respiratory diaphragm is to make sure there is no confusion about what type of diaphragm I could be talking about. Do you know what I mean? Like a diaphragm, like somebody could, like, as a women's health therapist, think I'm talking about something else. So it's your main muscle of respiration, but it's also mechanically a pump. And this pump helps low pressure systems like the veins, the venous system, and the lymphatic system. Because you all know that the heart is a pump, but like the diaphragm pumps as well. So breathing, diaphragmatic breathing, isn't just about the oxygen in and out. It's a pumping system. So when you take a breath in, the diaphragm contracts, goes down, and increases that like negative pressure. When you exhale, it relaxes, and then there is a recoil. There are basically two types of mechanics that go with this though. So if we're talking about the ribs, which ribs attach to the thoracic spine, when you take your breath in, the ribs will go up. When you exhale, they come down. But there are two types of motions with ribs. There's pump handle, and then there's bucket handle. And when people have been having respiratory issues, they start to do more shallow breath, and it's more of that pump at the top versus that big bucket handle. So I mentioned in a previous video about if you had long haul COVID and you had some respiratory issues, working on diaphragmatic breathing is really important because people lose that bucket handle motion because they stop taking those big full breaths, and then they start to have shallow breaths. And you know what happens when you start to have shallow breaths all the time? You become anxious, panic attacks. Yes. In other cultures, when people have panic attacks and anxiety, they teach them how to change the chemistry by changing their breath. Yes, so you can change your anxiety based on breath. Hit the plus sign and follow me for more tips.